Good evening, students. So, in this session, we'll deal with lymphadenopathy. So, lymphadenopathy is defined as inflammatory or non-inflammatory enlargement of lymph nodes. So, why examination of regional lymph nodes is important? Because it plays a crucial role in staging of cancers and planning appropriate surgical resection and helps in designing adjuvant chemotherapy and radiotherapy. So, few sites of examination commonly like submental, submandibular, cervical, axillary, inguinal lymph nodes, internal mammary nodes. You can see here. So if you see in the head and neck, these are the most prominent group of nodes which we are going to examine. Like these are the submental lymph nodes which are located below the symphysis menti. So these are submandibular lymph nodes which are located in close relationship with the submandibular gland. So these are parotid lymph nodes which are located in relation to the parotid-mesenteric fascia and parotid gland. So these are pre-auricular lymph nodes in front of the auricle, and these are the post-auricular lymph nodes, otherwise called mastoid nodes. And here you can see the tonsil, the palatine tonsil. So tonsillar lymph nodes, so which are very close to the palatine tonsil. And you can see here these are the superficial cervical nodes and these are the deep cervical nodes. And here you can see the posterior cervical and this is the supraclavicular node. So these are the axillary group of lymph nodes. There are 5 groups, namely, as you see, this is the anterior axillary nodes, these are the posterior axillary nodes, these are the lateral axillary nodes, this is the central axillary nodes, and this is the apical axillary nodes. So these anterior axillary nodes acts as the sentinel node for breast malignancy. So the first lymph nodes which receive the lymphatics from the upper outer quadrant of the breast are the anterior axillary lymph nodes. So these are the inguinal lymph nodes. This is the superficial group and this is the D group. You can see here these are the D group of lymph nodes. A, B and C, 3 are there. Here you can see the superficial group of inguinal lymph nodes which are divided into horizontal and vertical group. So if you see the horizontal group, it is again divided into lateral and medial groups. So there are a few named nodes in the abdomen. You can see here these are the ileocolic lymph nodes along the ileocolic vessel. These are the paracolic lymph nodes. So this is prececal lymph nodes. These are retrocecal lymph nodes. These are superior rectal lymph nodes. These are inferior mesenteric lymph nodes along the inferior mesenteric artery. So same way there will be superior mesenteric lymph nodes along the superior mesenteric artery and celiac nodes along the celiac artery and hepatic nodes along the hepatic artery. So you can see here these are the left colic lymph nodes. So here if you observe, these are the pre-aortic nodes. So these are the common iliac nodes which are along the common iliac artery. These are the external iliac nodes which are located along the external iliac artery. And these are the internal iliac nodes which are located along the internal iliac artery. So same way we also have popliteal nodes in the popliteal fossa. So what we have to do with these lymph nodes? So there are two methods of examination. One is the inspection, the other one is the palpation. So if you see the inspection, superficial lymph nodes are visible when enlarged. Skin overlying lymph nodes may show redness suggestive of underlying inflammation. Same way if you see the palpation. So in the palpation, we can feel for the tenderness when we test the region of the lymph nodes and raised temperature in the enlarged lymph nodes, so is suggestive of underlying inflammation. So and these sites also will give a fair look into the probable diagnosis. Like if you see the deep cervical nodes are enlarged, most common cause might be the tuberculosis. If you see the Virchow's node, left supraclavicular node, the underlying cause might be stomach cancer or testicular malignancy, inguinal lymph nodes, filariasis. So these are commonest causes in these regions, but definitely there are other causes for these regional lymph nodes. Then causes of the lymphadenopathy. If you look into the inflammatory causes, it might be acute lymphadenitis or chronic lymphadenitis. Chronic lymphadenitis might result from sepsis, tuberculosis, syphilis, filariasis, lymphogranuloma, inguinal. Neoplastic causes are primary. Primary is origin of malignancy within the lymph nodes, or secondary. So secondary is the most commonly seen, like sarcoma, carcinoma, malignant melanomas. So primary cancer is in local viscera and metastasis from that viscera to the regional lymph nodes, resulting in the secondary malignancies. Hematological causes are Hodgkin's lymphoma, non-Hodgkin's lymphoma, and chronic lymphocytic leukemia. So you can also see immunological causes like serum sickness, drug reaction, systemic lupus erythematosus, and rheumatoid arthritis. So generalized lymphadenopathy causes are like tuberculosis, infectious mononucleosis, secondary syphilis, HIV, Hodgkin's lymphoma, leukemia, sarcoidosis, brucellosis, toxoplasmosis, and the list goes on. So generalized lymphadenopathy. In earlier cases, if you see like sepsis, tuberculosis, syphilis, filariasis. So in these things, certain regional nodes are enlarged. But if you come back here, if you see in these conditions, generalized entire like multiple regions in the body are enlarged. So surgical resection of any malignant tumor requires removal of regional lymph nodes. Very important. So regional lymph nodes after removal can be sent to histopathological examination to confirm involvement of malignancy. Then leaving behind regional lymph nodes during resection of tumor leads to recurrence of cancer. Thank you.